here we go again with the throw pillows. All right, guys, if you are experiencing symptoms such as a decreased urine flow, if you are struggling to fully empty your bladder, if you are running to and from the bathroom every day, increasing in the number of urges that you are getting, and if you are getting urine dribble after you are done urinating, either in your pants or on the floor, chances are that an enlarged prostate is the culprit behind these issues. Hence why I'm making this video, and I don't know how long it's going to remain up because I think it's gonna upset a lot of people that I'm making it. Why? Well, there are a lot of urologists around the world that are promoting very, very expensive and invasive procedures to either remove your prostate or to shrink its size, helping to get you those decrease in symptoms that you are so desperately looking for. Now, to set the record straight, I'm not a urologist. I'm a doctor of physical therapy. Very different things. I'm not trying to pretend to be something that I'm not, but my specialty is in helping guys better manage these symptoms and help them to improve their lifestyle factors so that they can go on living a healthy life without maybe needing to get one of these expensive procedures. Because if you weren't aware, getting a TERP, getting a resume, or the green light, or even a prostatectomy, depending on where you live in the world, these are really expensive surgeries. And what oftentimes doesn't get discussed is the aftermath afterwards. You are sold on the promise that doing one of these procedures is gonna get rid of all your symptoms, but you are talking with the guy that has helped hundreds of men worldwide with the aftermath. The aftermath I'm talking about is increased urinary issues such as leakage, where it just seems like you can't turn off that tap, erectile dysfunction, pain, needing incontinence pads, so diapers, for a specific amount of time after the surgery. Now, I'm not saying that those surgeries and procedures don't have their place, because they do. If your prostate is a certain size, sometimes you're going to be left with that as your only option. But for the majority of the guys, the majority of you watching this video right now, there is so much that you can try to help shrink your prostate and decrease your symptoms before resorting to those procedures. And in my opinion, because an enlarged prostate is not prostate cancer, those procedures should be the last resort. What a lot of you need to realize watching this video is that your prostate didn't just grow to this size overnight. It's been accumulation and a gradual growth over time. For us men, our prostate naturally grows. We know that from research. But what speeds that up is our lifestyle factors, our diet, what we are consuming, how much exercise we are getting in. All that plays a pivotal role, even our genetics, into how fast our prostate grows. And obviously, the speed at which it grows. So the faster that your prostate grows, the more of these symptoms you are going to experience. Now, a comment that I get underneath a lot of my YouTube videos is, Eric, how do I naturally shrink my prostate? Personally, I think that this is the wrong way to go about it. This video is going to help you do that, but I like to look at it as managing your symptoms because we can't see our prostate. It's really deep inside us. What is telling us that we have an enlarged prostate is, number one, you've been to your doctor and you've had it measured. So it's in cc's as the units. You should know what is the size of your prostate. You should also have blood work done, and you should have a doctor do an internal examination so that they can tell you, Bobby, an enlarged prostate is the reason why you are getting your urine leakage or your incomplete bladder emptying or your urine dribble. You need to know what is the actual culprit and how big is your prostate so that you have a baseline measure to track everything with. All right, guys, really quick, before we get on with the video, continuing to help you shrink your prostate, I need to tell you about today's sponsor, Manta Sleep. Now, if you are a regular viewer of my channel, thank you, you will already know that I have worked with them for many videos in the past. Now, I stand by this. These sleep masks have made such a difference to my life. If you're watching this video, you're probably a busy professional, you have busy family lives, busy professional lives. We can all use a little bit better sleep, better quality and better quantity of sleep. One of the best ways to do that is by regulating and standardizing your sleep environment. Now you can control how bright your room is by using one of these Manta masks. They make the most premium sleep eyewear I've ever tried in my life. Long gone are the days where you use one of those cheap masks that hurt your eyelids. They have cups that go around your eyes that are so comfortable, and they offer 100% blackout capability. I can't see a thing. Now with this version right here, this is the Manta Sound. This actually has adjustable speakers that are in the mask, and it connects by Bluetooth to your phone so that you can hook up a sleep meditation, you can listen to a podcast, you can do anything that you want leading up to bed to get you in the mood to go to sleep, to naturally just wind down. Now, my favorite mask is their new Black Pro mask here. Put it on. It's fit perfectly to my head, so it has an adjustable strap in the back. And the nice thing is too, it has little gel inserts here that gently grip your head so that this doesn't slide off when you're sleeping. I wake up with this in the same position every single morning. Now, if you know anything about me, you'll know that I travel back and forth between Canada, America, and Australia a lot. And I do not leave home without bringing my Manta sleep mask. Now, why do I have two here? Well, I loved it so much that my wife also wanted one, so I had to get them to send her one as well. I put all my family members onto them. They are just the best products to help you get better sleep. And if you're trying to shrink your prostate, well, you're gonna need to get better sleep as well, because this is a long process. So please, if you're serious about starting the new year with better sleep and feeling more energized, which is gonna help you boost your testosterone, it's gonna help you lose weight and get in better shape, look no further than Manta Sleep. So go on, you can use my discount code on the screen, go to their website, check out their entire range of sleep masks, and have a look and see if one sticks out to you. Thank you so much, Manta Sleep, for sponsoring our channel, for helping me improve my sleep. Back to the video, come on. Next, we need to decrease your symptoms, because there are gonna be some of you watching this video right now that have a very, very large prostate, but your symptoms are only minimal. That's going to vary from person to person. So I think a much more productive way to look at this problem is, let's attack the symptoms first. All right, so what do I mean by that? The symptoms I'm talking about are, Eric, I don't feel like I'm ever fully emptying my bladder. Eric, I'm getting urine dribble in my underwear and I'm embarrassed that it might be leaking through my jeans. People can smell it and people can see it. Or Eric, I have to pee triple the amount during the day than I had to 10 years ago. What in the world's going on? These are 3 symptoms that we can easily manage without a procedure or without pharmaceuticals for the large part. How do we do it? Well, number 1, we need to do what's called a double void. Every time that you go to either the urinal or you're going pee at home, you should be peeing twice. That is allowing your body enough time to fully empty your bladder. The more urine you can remove from the bladder every time you go pee, the less the prostate is going to impact you. What do I mean by that? Well, when you go pee, you should either be sitting or you should stand. I've made so many videos on that topic in the past. Go to my video library and click one of those, okay? So a double void is you pee twice. You might start in the standing up position where you pee naturally until everything's done. Give it a quick wiggle. Take a few seconds worth of a break to and relax the pelvic floor, and then you sit down for the double void. Double void just means peeing twice. And then you sit down, lean forward or back, and you try to pee a second time. But you do this every single time you go pee to start retraining that bladder to empty fully. Because if you're not getting 100% of that urine out of your bladder, well, it's no wonder why it's filling up more quickly. It's no wonder why you're dribbling afterwards, because you're probably rushing the process of peeing. And when you have an enlarged prostate, it just amplifies that. So this would happen anyway, but the enlarged prostate's making it worse. This is how we attack the symptoms. So number 1 is doing a double void. Number 2 is learning how to do Kegels contractions, which is strengthening up the muscle group called your pelvic floor. By strengthening up your pelvic floor, you are now able to empty more efficiently. You can push a lot more of that urine out of the bladder. You can hold your bladder a lot more efficiently too, where you're not leaking. So I've made so many videos on that topic again. This video is just going over where your attention should be, in my opinion, to help you shrink your prostate and better manage those symptoms. So number one, we have double void. Number two, we have learning how to do a Kegels contraction properly. I've got a video that I will link in the description where I explain this really, really well, or so the comments have told me. Go through that video, learn how to contract your pelvic floor properly. Then number three is learning how to do pelvic floor stretches, because for most of your life, you have been sitting, you've been standing, getting into cars, driving cars. The point I'm getting at is these muscles, your pelvic floor muscles, they become really, really fatigued and tight as well. And if you just go and do hundreds of Kegels, it's probably gonna make your problems a little bit worse. So getting into a nighttime stretching routine is a really helpful way to just relax everything, preparing you for the next day of one, having better bladder emptying, two, less urine dribble, and three, hopefully decreasing the amount of urges you get to go pee every day. Now, number four is going to be your diet. Guys, a lot of you aren't gonna wanna hear this, but the diet you have been consuming up to this point in time has most certainly contributed to your prostate growing and that growth just getting out of hand. We need to call a spade, it's your diet. What I have found through the research and what I have found in the comment section of people that have successfully been able to shrink their prostate and to better manage their symptoms is, number one, they have all cut out sugar. They have mercilessly cut out sugar from their diet, all of it. They've cut out processed foods, all of it. And they have started to eat more of a plant-based diet. Now, I am a meat eater, so I would have a really hard time with that. What I suggest is go a bit more plant-based, but also still enjoy your meats during the day as well. You need a bit more of a balance. Sugar is the enemy here, gentlemen, and I need you to be very honest with yourself. Have a really hard look into your lifestyle habits up to this point in time. And if you are being honest with yourself, you probably haven't had the best diet, but it's not too late. By cutting out sugar, that is helping to decrease your overall levels of inflammation in your body. Think of it this way, when your prostate is getting bigger, it's inflammatory, it's inflaming, it's growing. Well, that's why you have good days and bad days with your bladder problems, with the symptoms you're experiencing. It's impacted by your diet. So if you have a day with lots of dairy, lots of processed foods, and alcohol, and lots of sugar, well, the following few days, those symptoms are gonna be that much worse. If you can cut out sugar, if you can cut out a lot of the processed foods that you're eating. And sugar, guys, is gonna be like sugary sodas, pops, junk food, sauces like ketchup and barbecue sauce that are just loaded with sugar. If you can cut out a lot of that and just make it a little bit more reasonable, you're already halfway there. And now, another thing that we need to discuss is that a lot of you watching this video are going to expect immediate results. Gentlemen, this didn't happen overnight. This has been the accumulation of years and years and years. And that's why so many urologists are able to sell the expensive procedures, because they guarantee you quick fixes without really telling you about the aftermath. Again, do your own homework and do whatever you'd like. I'm just here to present you a natural way about going to do this. And if you're committed to the natural way, it's gonna take you a little bit of time. You should be prepared to track your progress over 4 to 6 months. It's gonna take a while. So by focusing on your diet, you're also gonna find that you are able to lose weight. You're able to lose weight around the midsection. That plays a massive, massive role on decreasing your urinary symptoms. So how efficiently you're emptying your bladder, it's gonna help you reduce the amount of urine dribble, and it's gonna help you reduce your overall times that you are going to the bathroom during the day. You need to lose a little bit of weight. But if you focus on cutting out sugar, eating more vegetables, still eating meat, but cutting down your dairy and processed foods, that is halfway there, okay? Now, fluids. Fluids is a big one. What you drink directly impacts your bladder. It can excite the bladder, so cause it to spasm. It can dehydrate your bladder, and it can also cause more urine production. So that's also known as a diuretic effect. Now, the things that you should be looking out for in your hydration plan is caffeine. Caffeine, gentlemen, for enlarged prostate is a big one. Now, I'm not a crazy person, and I would never tell you to cut out caffeine entirely, but you should be trying to decrease your caffeine intake. If your symptoms are bad, and they probably are if you've landed on this video, I would be sticking to 1, maybe 2 cups of caffeinated coffee a day. Now, if you drink decaf, you need to know that there's still caffeine in decaf coffee, just not as much as the caffeinated version. So cutting out caffeine, cutting out caffeinated drinks like Coke, like Pepsi, like tea. There's a lot of hot teas out there that are still caffeinated. That is going to wreak havoc on your bladder. That's making your symptoms worse. And again, that's why I'm going with more symptom management versus it's gonna shrink your prostate. Shrinking your prostate happens when you attack it with all of these strategies at once. So Kegels, better bladder emptying, pelvic floor stretching, diet, focusing on your hydration. So have a look, and what I would recommend is actually track your diet and your fluids across a week. So either use your iPhone or your Android, get out the Notes app, or just use an old-fashioned pen and paper. Write down every day, what are you eating? And be really, really honest with yourself. What are you drinking? How much alcohol are you consuming? How much soft drink, fizzy drink, soda are you drinking? Pop. Be honest and get an idea of what you're working with, because only then can you see it. When you see it on a piece of paper, you can then go and highlight it. I need to make changes here. So once you get a better diet in place and you modify your hydration, you are 3/4 of the way there to starting to see those symptoms lessen in severity. And that's what you're looking for here. What's next is exercise. This is going to really bring everything full circle, okay? So exercise, my best recommendation is, well, number one, make sure you are chatting with your doctor, your GP, on what's safe for you. Because all of you watching, it's gonna be different. But what I recommend is 5 days of exercise per week. So 3 aerobic exercise sessions, so that might be speed walking, running, cycling, rowing, whatever it is that you like to do. 3 aerobic sessions per week, around 30 to 40 minutes each. And then 2 strength training sessions. Now, if you don't have any gym equipment available, or if you don't have a gym membership, you can do body weight exercises, that's fine. And there are so many videos on YouTube going over a body weight or a gym-based program. So if you're only gonna do 2 resistance training sessions per week, I would recommend an upper body and then a lower body day to kind of get that full circle and to cover all your bases. You need more exercise. The diet and the exercise, they go hand in hand. And again, we're tracking this 4 to 6 months, and you're just seeing how those symptoms lessen over time. Now, before we get into the next tip I have for you in helping you naturally shrink your prostate is I would like you to honor our gentleman's agreement. Now, for those of you that don't know, our gentleman's agreement is our virtual handshake deal, where if you've watched more than one of my videos, you are going right now and you are clicking that subscribe button, that red button right underneath the video. You can do it right now while watching. Click subscribe, and then where the real magic happens is when you comment the words gentleman's agreement in the comment section below. This is so that I can personally reply to that comment and welcome you to the greatest men's health channel on all of YouTube. And if you haven't noticed, on any of my other videos, we are getting hundreds, if not thousands of you commenting gentleman's agreement. We are strengthening our community because, guys, there needs to be more of us talking about men's health. And the more people we get in our community, the more YouTube will push this channel worldwide to more men that might need help too. I don't know why there aren't more of us talking about it, but these are really, really important topics that need to be discussed. So please go on right now, honor our gentleman's agreement by clicking subscribe, and then comment gentleman's agreement in the comment section below so that I can reply and welcome you. Moving on. Now, the 5th or 6th, I kind of lost track here, thing that I would like you to consider so that you can go away and do your own research on is supplements. Now, at the beginning of this video, I was sharing my opinion on the side effects and the downsides to procedures such as the green light, a TERP, the resume. There's hundreds of procedures that you can get which are classified as invasive, okay? But there's also medications that they can give you too, alpha blockers. So an alpha blocker would be like Flomax or the tamsulosin. Same thing, it's just one's the commercial name for the drug. These medications can have side effects as well. Yes, they bring down the overall inflammation, but they have unwanted side effects. And if you aren't addressing the symptoms, so the double voids, the Kegels, the pelvic floor stretching, your diet, well, you're gonna be on that medication for a really, really long time. And guys, that medication's not cheap. So in my opinion, those should be the last resort, the safety net. At least you know that they're there. Again, consult with your doctor first. But trying the natural way, in my opinion, and again, I'm not a urologist, is the best way to go. So The fifth or sixth, the final thing we need to discuss is supplements. I'm gonna put a list here of a bunch of different supplements that you can go and do your own research on. Now I'll number these. These are in order of what I think are the most beneficial, and I base that off of research studies and other videos that I've done in the past where I've gotten really good results from my clients using these. So I'll put that somewhere on the screen so you can screenshot it and just jot those down now. But supplements are a great addition because they're different from medications. They're naturally occurring substances that are already in our body that you're just supplementing on your diet on top with. So taking supplements could be a great part of your routine to help you bring down that overall level of inflammation and swelling that's occurring in the prostate. Now, what I think would be best is you don't want to just go and try all these supplements. It's not a one size fits all. You want to pick and choose ones that meet your requirements. So see the list right here, go and do your own research and pick one or two and then decide whether or not that would be a good idea for your situation. That kind of brings everything full circle. And if you haven't caught on by now, this is what's called a holistic strategy to helping you naturally shrink your prostate. So number one, we have targeted and we have honed in on the symptoms. We've done that by now putting in a double void. Every time you go pee, you are to pee twice. Every single time, both at home and in public. I've got so many videos covering a double void. You pee twice, be a little bit more patient in the bathroom. Number two, you start doing a gradual Kegel strengthening program. Again, I have made so many videos on this in the past. I'll link them down below. And I've even made a Kegel program that you can go and download and follow. I'll include that in the description of this video. It's all gonna be listed there. Number three, you can add in pelvic floor strengthening. Well, if you download my Kegel program, I include pelvic floor strengthening in it for you, so you can just follow that routine. Number four, we need to attack your diet. Cutting out sugar, cutting out processed foods, eating more of a plant base, so more of your veggies. That is going to help you so much. Just decrease the natural levels of inflammation. And then number five, targeting your fluids. Trying to cut out alcohol, trying to cut out or reduce your caffeine intake. No more sugary drinks like Mountain Dew, Pepsi, energy drinks. They're terrible for you and they are making your symptoms so much worse. Plain old water is definitely the way to go. And then exercise. If you're not already exercising, start small. That might just look like a walk per day. If you're more intermediate to advanced, I want you to push your body. So I would do, if that were me, 3 aerobic sessions per week and 2 resistance training sessions per week as well. 5 days worth of exercise, trying to lose some weight, trying to lose more of that midsection fat. Your symptoms are just gonna come down so fast. And then lastly, it is supplements. So doing some research on your own, finding supplements that you think might help you. Again, I'll leave that list here and in the description below. And that's how I would create a really well-rounded, holistic plan to naturally shrink your prostate. This isn't gonna happen overnight. Like I said in the beginning, track your results over 4 to 6 months. If you're not gonna do it, it's not gonna work. And you're gonna end up in my comment section, unhappy. Like some of you are already typing this, Eric, I've tried this. Well, that might be that your prostate is just too big. That's why I suggested at the beginning that you go and get it measured. Know the size that you're starting with, okay? And you need to dedicate some time to this. Your last resort, your safety net, is one of those procedures. Remember, regardless of your situation, keep going, and I'll see you in the next video.